Hello, hello, and welcome to our Facebook Live at 5 with Baxter Professional Services. I am Tina Baxter, and I am your hostess. And also, welcome to those that are following us on our Nurse Shark Academy page. I'm so excited to be here today on June the 8th, Wednesday, June the 8th. And we've been running a little bit behind our time today, but that's because we've had a phenomenal day and have had a lot going on. So let's go ahead and jump in with our affirmations for today. And just because I really like this other affirmation, we're going to have four today because I just really loved it. And I could not resist adding it. So our first affirmation was from Saturday, June the 4th. And it says, I trust my future to be bright always. I trust my future to be bright always. From Sunday, June the 5th, I love this one. Others are different, not wrong. We are all one. Others are different, not wrong. We are all one. And I love the picture of the seashells on there as well. And this is from Monday, June the 6th, and it says, today and every day I am free to be me. Today and every day I am free to be me. And then for today's affirmation, this came at the right time for me, and I'm going to tell you why. But it says, there is enough time and space for everything I want to do. There is enough time and space for everything I want to do. So I'm excited about that. That was just for me today, so I had to add that in there. This is from our 2022 calendar by Louise Hay, the I Can Do It calendar. And again, Louise is not paying me any money, but Louise, if you want to put me on, that's fine. That's great. Let's do it. But I love her affirmations, and so I like to share them with you. And I do keep them, so I have all of them as I tear them off every day. I keep all the affirmations, and I have them in with a binder clip. So I don't throw them away. I keep them because you never know when you need to have some inspiration for the day. So I want to tell you a little bit about what's been happening here and why I'm so excited today. So today I had the opportunity to be at the Anderson Public Library with the Indiana Department of Health. And they were having their partner-to-partner health fair where agencies come in and are able to talk about what they do. And I was able to be there to represent two different organizations. One is my own, Baxter Professional Services, and Ladies of Justice with PPLSI. I was able to represent that and talk about how we impact communities and help them get access to the justice system and to protect their identities from cyber attacks. So those are things that you, as you are aware and follow me, those are things that I believe in. I believe everyone should have access to the justice system, and I found a way to do that. And if you have any questions about that, put the comments in there. I'll be happy to share some more information with you about that and at a later time. But I was also able to talk about the Black Nurses Association and some of the initiatives that we have and the advocacy that we have for nurses in Madison County. And we want to obviously get new members. So if you know of any nurses out there in Madison County, Black nurses that would like to join us in the work that we do in the community, we provide scholarships for nurses. We're going through a nursing shortage, and I want to highlight some of the good things that are happening right here in our community. So I had that event earlier today, and I was able to speak with places like Jane Pauley and Meridian Health and the local health department, and all of these entities were there together to talk about how we can help one another in this fight that we have for health equity and equality, and also with the COVID pandemic. So we're able to come together for those sessions. So I'm very encouraged by that today. So I came out of that, right, to come back into a meeting that I have with my 100X family. Hi, 100X family, if you're watching. And we were talking about challenges, right? And I have a challenge coming up, which you'll hear about towards the end of the segment today. But, you know, I went from that meeting to another meeting from someone that I met in a Blitzer networking group. And I had a meeting with them, and then wrapped that all up with a podcast that I had a chance to talk on a small business podcast about legal nurse consulting. Why do I bring that up? Because that quote was for me today, and I hadn't had a chance to look at it until just before the broadcast. It says, "There's enough time and space for everything I want to do." I'm telling you this story not to say that, yes, my life is incredibly busy, which those of you who know me, yes, it is. But I also know that your life is incredibly busy as well. And I often hear nurses say, "I don't have time." This is a reminder to us that you have the time to do everything that you need and want to do. It just depends on your choices. So, I chose today to go to this event and be a part of it, and I'm so glad I did. I chose today to schedule a podcast, knowing that even though I had an event earlier, I'm coming rushing back in to do another podcast. I chose to do those things. I choose to be here every Wednesday because I find that it's important, and I want to tell you that you have enough time and space to do what you need to do. So I want to encourage you with that, and recognize that, yes, we all lead very busy lives, but I guarantee you that this is one of those self-limiting beliefs that may be keeping you from building your dream. So let's talk about the what I am reading segment. This is a book I picked up this book a while ago, and I've had it for a while, and I love it. The title is "What Are You Waiting For? It's Your Life. Proven Principles for Creating the Life of Your Dreams" by Jim Donovan. And I just wanted to bring out some highlights from the book because we're going to be talking about the challenge at the end of this segment about what's happening. So stay tuned for that, about the challenge that's coming up. Those of you that are on the Nurse Shark Academy page are aware of it, but we do have a challenge. I'm very excited. We have a group specifically for that challenge. We'll talk more about it. But I wanted to bring this out of what I'm reading. And this book has some great insights. And so he talks about beware of limiting beliefs. And that seemed to have been a theme for the past week. I've been in several sessions, and this is what they've been talking about, your limiting beliefs and challenging those things. So he goes right. He says, if you own a business, and you're holding a limiting belief that you aren't very good in sales, which is a common belief held by many non-sales professionals, the effort you expend won't tap your true potential, and you'll produce a less than desirable result. So I want to say that again. If you hold the limiting belief that you aren't good at sales, you're actually going to not be able to tap into your true potential, and you'll produce a less than desirable result. So how many times have we said, well, I could never be a business owner because I'm not good at sales? But yet we don't realize that we're selling every day. As a nurse, how many times have you sold a patient on taking their medications, right? You explain to them the risks, the benefits, why they should take it, what happens if they don't take it, all those different things. We sell them on the fact that this medication may help you, right? And education is a way of selling. Now, again, you're going to let them make their own decision, right? You're not going to force them. And you don't do that in sales either. You don't force anybody, good salesmen, don't force anybody to buy. You lead them to the path, give them the information, help them come to the decision to understand that what you have to offer is right for them. And so we do this every day, but we don't think of it as sales. We don't call it that. And so we think that we can't do it. And for years, I said I was a bad salesperson. I was a person that would buy the tickets to the event and then give them out for free because I didn't want to sell them. Okay? And so again, we have it in our mind that we're bad salespeople, but sales is not a dirty word. If we didn't have sales, how would you know about the latest and greatest thing? For example, I was in a car with my assistant, and she was saying, I just researched that the Subaru, and this is again not an advertisement for Subaru, but the Subaru is one of the highest safety features, highest cars that are safe, and this particular model. And I said, yes, That's one of the reasons why I purchased this car. It was because I researched it and I liked their safety profile. So I wanted to make sure that I got a car that was safe. And so she happened to talk about that and bring that up. And and basically what sold me was the safety features on this car. That's sales. And so she, looked it up and researched it herself and said, "Oh, I see that the Subaru is happen to be a very safe car." So again, it depends on what you're doing. So naturally, I'm not trying to sell her a Subaru. I'm not selling her my car. But I said, yes, I also found that these were good cars. And that's word of mouth marketing and advertising right there. So he goes on to say that challenge your own limiting beliefs by questioning them. If you begin to question a belief, you automatically weaken it. So can we question the limiting belief that I often hear from nurses is that I'm just a nurse and I'm not good at XYZ, or I could never do what you do? And my response is, of course you can. Your journey to get where I am may be different than my journey. We're all in different journeys. Remember, we're all different, but that doesn't mean we're bad. It's good, right? And he says, if you begin to question a belief, you automatically weaken it. The more you question your limiting beliefs, the more they are weakened. And so I began to question some of those limiting beliefs. Like, for example, I had a friend recently, Robin, tell me that I was a social influencer. Now, I never thought of myself that way, but I found out that I guess I am. Earlier today, I had a couple of people say, I watch your podcast on your Facebook Lives, and I'm like, oh yeah, so I can add that to I never think of those things, and this is what we do as nurses. We don't think of what we do as something special, but they are. You are those things, and it took me a while to start owning that because particularly for those of us that are female, we have a hard time with self-promotion. And so we don't think about the skills that we bring to the table. And so I'm happy to say, yes, I am a podcaster. I am a social media influencer. Never thought about that before. And I add those things, and I think so it changes my mindset and how I think about myself. I've already, know that I'm an educator and a speaker and a coach and a legal nurse consultant, and those are roles, but then I understand that there's a lot more than just that to what I do, and a lot more to me than just my roles and my titles. And so it's challenging those self-limiting beliefs and that whole, I've never really said that to myself, but, that I'm just a nurse. Because I am a nurse who, right? And so I want to change that for you. Change it to I am a nurse who does X, Y, and Z, but I'm still a nurse, and that's important. So he goes on to say that we all sell, and we do. He says, think back to a time when you sold someone on yourself. We are selling all the time. You have to sell your ideas to your spouse, your children, your employees, even your banker. Maybe as a child you sold Girl Scout cookies or magazine subscriptions to raise money for your school team. I was in the band, so I raised lots of money with the band, and then when I raised all my money for my trips, I helped other people raise money for their trips because for some reason, I was very good at that part, but I never thought of it as selling. I mean, I sold fruit, candy, stood on the corner performing with a cup. I forget how we called those things, but they were like days where you stood outside the bank and you'd make all this money. I would go from people in my church and people where my mother worked and my father worked and said, hey, we've got this going on. I've sold soap and laundry detergent for youth groups. I mean, I've done a variety of things, tickets for organizations, and I never thought of myself as a salesperson because I was doing it for charity. But he says, even though it was for your school, that was selling too. And I think it's a shift that we need to make in our mindset. So he says, you want to reinforce your beliefs by adding more and more legs to them. like a stool or a chair. It says, find people who have accomplished what you want to accomplish, discover what they did, and model their behavior. And that is what I purpose to do. And I've had wonderful mentors in my life, and I continue to have these wonderful mentors, and I watch what they've done. I see how they've changed their business model to where they've added services and added things on to their business. And so, and I've modeled that after that. But I do it in my own way, in my own unique way. And I encourage you to find your unique way to do that as well. So let's go ahead and get into the news, because I want to get to the good stuff at the end, right? All right, so let's get into our news segment. I want to start off with this story out of Florida. I find it kind of interesting, state of Florida. So if you're in Florida, this might interest you. But this came from WFLA. And they said that Florida nurses earn $10,000 below U.S. average salaries, according to a report. So it says across the United States, nurses on average make a wage of $82,750 per year, according to the U.S. Bureau of Labor Statistics. And the state of Florida, the average salary for nurses reportedly $72,000. However, in Sebring, a study of nurses' salaries say the city's nurses make just $48,400. The study of BLS statistics was produced by Simple Nursing. When factoring in cost of living adjustments, the organization said the salary is roughly $52,000 per year for Sebring nurses. However, the overall state is still not competitive with the national average. The data from Simple Nursing is slightly different from the BLS. According to the federal government, the annual mean wage for Florida nurses is $72,000. Still, Simple Nursing said Florida nurses earn $33 an hour on average, a wage $4 lower than the national level. BLS reported Florida nurses make about $34 per hour. So there's a deviation of about $1 there. Nurses are at the forefront of patient care and collectively comprise the largest healthcare occupation, the Florida Hospital Association said in 2021, a report on nursing staff projections through 2035. Between 2019 and 2035, the period covered by this study, Florida's population is projected to increase by 21%, with the population age 65 or older projected to increase by 51%. Population growth and aging will increase the demand for nurses. So Florida is aware of this. So Florida's legislature and Governor Ron DeSantis prioritize ways to provide higher pay and more employment opportunities in the state. While some of the legislative efforts face opposition from industry and patient advocates, the bills still pass. Even the recruitment and training efforts by Florida and other U.S. states, the American Health Care Association reports that staffing needs are still high, particularly in nursing homes. In a report published in June, the AHCA said 60% of nursing homes were experiencing worse staffing situations since the start of 2022. I bring that up because I think we need to know what the average employment is for nurses, as we're debating on our nurses being paid too much. So in California, for example, it's estimated, according to this data, that nurses earn a mean wage of $59.62 an hour, which is about $124,000 a year, compared to Texas, where the average hourly wage was $38.04. Compare that to New York, which is $44.86. And in Pennsylvania, it's $36.54. So I'm going to do a quick, just because I want to know, always want to know, Indiana nurse wage average. Okay. So according to Incredible Health, nurses in Indiana can make anywhere from $48,000 to $90,000 a year. So I'm just going to look at Indeed.com, and they said that the average salary for nurses in Indiana is $39.49 per hour. And that with your years of experience, that can go up with the top of more than 10 years of $46.65. Now, if you go back and look at the information from California, that's still very low, but apparently still not as low as Florida, which, and especially in Sebring, where the nurses are bringing in $48,000 a year. So they're just making $33 an hour. So when we talk about nursing salaries being too high, what are you talking about? Because we're seeing that a lot of the nurses aren't making the outrageous money that people are touting that they are. So I'm bringing that up because we need to think about this when we're going forward and talking about nursing wages, and the fact that Florida is going to be getting higher older adults, so they're going to need more nurses. And so that also goes to the practice environment and whether or not nurses feel like they can take care of their family. I mean, I know nurses that have to take second jobs in order to make ends meet because they aren't making enough in their job. And these are the people that we are relying on in keeping our healthcare systems going. So let's talk about Oregon because I wanted to bring this up. So this is a case out of Oregon. This is from nurse.org. I came across this story from today, and it says Providence nurses vote to strike in Oregon. So we have yet another nurse strike. Nurses at St. Vincent Medical Center in Oregon have overwhelmingly voted to strike, citing problems with staffing levels, working conditions, and pay. The Oregon Nurses Association, which represents the hospital's 1,600 nurses, has been in negotiations with the hospital for over a year without reaching an agreement. Their contract expired in December 2021 with no resolution between the hospital and the nurses union. Heather Dodson, CDN, a dialysis nurse at St. Vincent, says Providence has been unsafe for about a year and a half. Heather recently transferred from Providence Portland Medical Center, St. Vincent's sister hospital. Nurses are burning out. We don't have enough people to staff units, and you don't get breaks. Which is, sorry to say, but that's kind of typical in nursing across the board. Dodson noted that patient safety is a severe concern and expressed problems with low pay and poor benefits despite St. Vincent's being one of the most profitable hospitals in Oregon. This goes back to a story that I recently read in an article, and I meant to bring it here, but I didn't get a chance to, about how, it was on LinkedIn, about how hospitals are paid and nursing services, all the complex things that nurses do, gets bundled into the hospital room charge. So there's not a separate charge for what we do, getting your IV started. All those different procedures that nurses do are not being billed or charged, and that's the way our healthcare system runs. So when you think about this, it doesn't give the hospitals an incentive to provide more nurses because it's tied to that hospital bed. Now the doctors, that's different. Their services are billed out and what they do, but nurses actual what they do is kind of hidden. So if it takes you 30 minutes to do a dressing change on someone, right, which would be a very complex dressing change, that doesn't get billed any differently than you providing them a meal tray, or as they said in the article, providing the same cost as Jell-O. Right? And so it's all rolled into one. And so that's a problem with our healthcare system, is because there's no real incentive for hospitals to pay their staff and to get additional staffing. So this has been an issue. So let's take a look real quick, and I'm going to look this up, and let's see what Oregon nurses. Let's see what their salary would be, just to compare it to the other study. So according to Indeed.com, Nurses in Oregon can make a base salary of $42 an hour on average. The lowest is $37.96, with the highest of being $49.61. So again, still kind of low from the national average. And so that's where some of the nurses are complaining about the low wages. I bring this up again is because this isn't nurses being greedy. This is nurses that are tired because there's not enough of us to go around, and there's no real incentive for the hospitals to hire any more nurses. So Kevin Paul, registered nurse and chair of ONA's labor cabinet, said that the decision to strike came from a need to stand up for nurses' rights and protest Providence's unfair labor practices. According to Paul, nurses have been trying to find common ground with the company, but Providence has refused to compromise. The strike is a way for nurses to make their voices heard and ensure that their patients receive the best possible care. Of course, St. Vincent's has a reaction. And so, responding to the news of the strike, Gary Walker, Providence St. Vincent spokesman, said that the hospital has tried to negotiate constructively with ONA in order to deliver more comprehensive pay and benefits. He stated that ONA's latest move is simply, quote, just the latest attempt to delay meaningful conversation. I'm sorry, you guys had a year. Walker believes the action taken by ONA prevents nurses from, quote, receiving the substantial pay raises and expanded benefits they deserve. He urges them to continue talking so that they can reach a mutually agreeable resolution. So I'm going to say that a lot of times in healthcare, nurses, we might get a 1% raise. I remember I was working as a CNA at the time for a local hospital, and my boss calls me and says, hey, you're getting a raise, because we had to raise the minimum wage, so you're going to get a 1-cent raise. And I'm like, a penny. She said, well, 1 cent is 1 cent. Really? And so it's those types of responses that cause a lot of frustration with nurses. And I've certainly seen it. I've worked in agencies where I no longer work for those organizations where I didn't receive any raises within 7 years. So again, it's those issues that our nurses are fighting against, and they're making their voices heard. And so if you want to read more about this, go to nurse.org. You can find it on their website, but you can read more about what's happening in Oregon. But we're going to keep an eye on that situation and how it goes forward. So let's take a step really quick across the pond, because I want to talk about what's happening in the UK. This is another story that came across my desk from Nursing Times, and it says, nurses with long COVID need equitable and effective support. So again, this isn't just us in the United States complaining and we've got it all good. This is nurses across the world that are talking about working conditions. So it says, members of the Royal College of Nursing have voted in favor of a campaign to improve support for nurses with long COVID in the workplace, as those among the profession share their poor experiences. One nurse told how they were made to feel like a nuisance or an inconvenience because of her condition, and that they must return to work early before feeling 100% better or risk losing their jobs. Others reported feeling as if they were not being heard or taken seriously, while some said they've been given some reasonable support. And so this is happening all over the world. Nurses are feeling the brunt of what's happening. The symptoms of long COVID include fatigue, joint pain, brain fog, and it requires ongoing management and treatment. There's also concerns that more than 2 years after the pandemic, accurate figures of nurses with long COVID are available, and stress that there's something should be lobbied against across the 4 nations. So again, this is happening in the UK. I want to say that, you know, we feel for you over there across the pond. This is happening to nurses all over, that nurses are starting to take a stand and say, we're not going to be silent any longer. Something needs to be done about the working conditions of nurses. So lastly, before I move on to our last story, um, our more upbeat story, I wanted to talk about this issue. This came from unionleader.com. I just found this article about this nurse, and so we're going to keep an eye on what's happening here. I like to bring up nursing issues because one, it could be a cautionary tale for the rest of us, but it kind of lets us know where the state of the environment in which we're working in. So this is stolen or lost fentanyl prompts reviews of Cheshire Medical Center's chief nursing officer. I find it interesting that they focused on the nurse. I want to start out here. They talk about the chief nursing officer. In the article, they also talked about the pharmacists and all these other people that are involved, but the top of the article is about the nurse. I kind of question that. Just saying. Nurses, nurses, we are kind of under attack here. So it says, a significant amount of missing fentanyl from the intensive care unit at Cheshire Medical Center in Keene has prompted multiple investigations and the suspension of the chief nursing officer. Registered nurse Amy Matthews had her license suspended on May 26th according to the order of emergency suspension by the State Board of Nursing. At the hospital, Matthews manages nursing operations including security, accounting, and management of controlled substances. The amount of fentanyl solution lost or stolen was more than 583 bags, approximately 7.7 gallons, between September 2021 and January 22. According to the order, more fentanyl was reported lost or stolen between April 10th and May 7th for a total loss of 7.84 gallons. An investigation attributed 303 lost bags to nurse Alexandra Toll, who admitted to taking the solution. The remaining 280 were unaccounted for during the winter surge of COVID-19, according to the order. Toll admitted to diverting 200 bags of fentanyl in January, approximately 100 bags in December 2021, approximately 50 to 100 bags in November 2021, and approximately 12 bags in October of 2021, according to a preliminary agreement not in practice. She signed the agreement on February 8th. According to the Board of Pharmacy documents, Toll took the fentanyl, quote, for her own use as a way of coping with the stress of working during the pandemic, end quote. Again, I'm not excusing Nurse Toll's actions of stealing, but it goes to that bigger issue of workplace environment. And were there measures in place to help with the mental health impact that nurses are facing because of the pandemic of COVID-19, on top of what we were already experiencing with nursing shortages and other things? So it says an email she sent to the hospital says she gave 12 bags of fentanyl to a friend, according to the document. Toll, or Tal, I'm not sure how you pronounce it, but Toll died unexpectedly on March 3rd. The hospital worked to come up with a corrective action plan to detect diversion and avoid losses, including training of nursing and pharmacy staff and daily accounting of its controlled substances according to the emergency order. To have such a significant amount of fentanyl lost under Matthews' management, even after remedial measures were implemented, indicates the licensee is negligent and or careless in her work, such that she poses an imminent threat to the public health, safety, or welfare, the order reads. Matthew has been a registered nurse since 1985 and joined Cheshire nursing staff in 2000, according to the hospital. She was recently recognized as senior nursing leader in the Excellence of Nursing Awards from the New Hampshire Magazine and the New Hampshire Nurses Association. I'm saying this because those of you that are at the DON and vice president level and nursing know that you may not be safe. What I find interesting, it says the Board of Pharmacy also suspended the licenses of Melissa Ciliano, the hospital pharmacist in charge, and Richard Crow, a licensed pharmacist. So, yeah, they got suspended. But the whole story is about the nurse, basically. Crow, who had no previous disciplinary action taken against him, entered a voluntary agreement on April 9th to no longer practice. Siciliano's suspension was vacated on April the 21st. Siciliano, there we go, testified she worked 50 to 60 hours before the winter surge of COVID-19 and nearly 80 plus hours during the surge. So again, and I am not faulting the pharmacists. I am not saying throw them under the bus either. We created working conditions where you put healthcare workers in situations where they couldn't possibly keep up with the demand because you won't hire extra staff. And then, you know, there's stories about when COVID-19, prior to the surges, they were laying off nurses. And we created this system to where now this is going on. So, you know, I'll keep an eye on this. But again, it goes to another nurse being scapegoated, because somebody's got to pay for it, right? And unfortunately, the nurse that did steal the fentanyl, she died unexpectedly. I don't know how or why. So you can't get answers there. But there's got to be something done about the working conditions for the nurses. And this is another example of an institution that didn't have proper systems in place that allowed this to happen, throwing nurses under the bus. So my question is, why isn't Cheshire Medical Center being sanctioned, fined? What's going on with them? Why are you throwing that nurse under the bus, the chief nursing officer, and taking her license when there has to be multiple people in charge of this? There's a systemic issue at Cheshire that probably needs to be addressed. And I'm afraid that we're going to be seeing more and more of this, because we had the Redonda Vault situation where they basically let Vanderbilt get away with murder, really, because they had a system in place that was faulty that allowed the nurse to make those mistakes. Now, granted, did Redonda make mistakes? Yes, I understand that. But you also have to look at the system which created the environment for those mistakes to happen. And I'm saying the same thing about Cheshire. Where is the accountability for the medical center? Why not throw the board of directors in jail? Why not do that, or fire them, or hold them accountable? Or how about the chief medical officer who prescribed it? I'm saying, why are we attacking nurses? So I know there's going to be more information about this. I want to keep an eye on this situation, but I'm bringing these issues out because as a nurse, we really need to think about our environment and advocate for ourselves. And until we start doing that, until we stand up and make positive change, until we start running for office, until we get a seat into the boardroom and demand that a nurse be on every hospital board, they must have at least one nurse on every hospital board, you're going to see things like this continue to happen. Until we change healthcare and how we're reimbursed, you're going to see things like this continue to happen because the hospitals don't have any incentive to hire more nurses. That's my take on it. Okay? All right. So I want to go to a happier case here for our Nursing Making a Difference segment, because I always like to end on a positive. This is coming from Effingham, Illinois, and this is from Effingham Radio, and it says Nursing Exemplar Awardees named at HSHS St. Anthony's Memorial Hospital. So in honor of National Nurses Week, HSHS St. Anthony's Memorial Hospital hosted a Nursing Exemplar Awards ceremony. Here's a list of the winners. Ancillary Team Member of the Year, Bo Sapp, Emergency Technician, Emergency Department. Clinical Excellence in Nursing, Jamie Davis, RN Radiology. Charge Nurse of the Year, Kenny Harris, RN Emergency Department. Preceptor of the Year, Christy Schumacher, RN Medical Surge Unit. And Rookie of the Year, Madison Healy, RN Medical Surgical Unit. And it says, quote, nursing is an extremely difficult but deeply rewarding career that is truly a calling, said Bobby Kinkler, Chief Nursing Officer. I couldn't be prouder of these nursing exemplar winners for their dedication to serving the people in our communities, especially over the last couple years. So I want to say congratulations to those nurses that received recognition by their facility in Effingham, Illinois. I always like to give a shout out to nurses. One of the reasons why I do these segments and I look for these stories online is because, yes, maybe in your community you are celebrated, but I think we need to broaden that narrative, and you need to be celebrated everywhere. And even though we have these stories of nurses, as in any profession, doing things that aren't right, you also have the nurses of the stories of the nurses that are doing the best. And I think we deserve to applaud and celebrate them as well. So I applaud you and congratulations to those nurses. And that ends our nursing Making a Difference segment. And so lastly, I want to talk about our challenge coming up. Our Nurses Get Mad Challenge starts next week. It's on our Nurse Shark Academy page. We have the new Facebook group available for those that are in the challenge. Go to the challenge. It is a free challenge. If you want to get the VIP ticket, sign up. If you register, you please register to be in the challenge. Register for the challenge, because that way you'll have the information. You can get access to the workbook. You become part of the Facebook group. I want you to become part of the challenge. So we're going to talk about getting mad as nurses. What do I mean? Do I mean angry? No, I'm talking about my audacious dream. We want to help you to build your dream, your audacious dream. So we're going to get mad and building my audacious dream. Not my dream, your dream. We're going to talk about the dreams that you have as a nurse, and I want you to think big and expand your mind and get ready to go for this event. So it will be June the 15th, 16th, 17th, from 6 p.m. Eastern to 7 p.m. For VIP, there's a Q&A afterwards for about a half hour, 45 minutes afterwards. For those who would like to stay and be part of the Q&A, we're really doing this because we want to promote nursing. And so I encourage you to come in and get mad with me. Let's build some dreams, right? So June 15th, 16th, and 17th. You can get the Zoom to become part of the Zoom. Get the backstage VIP. You can join us there. Tickets are available. You have hit the landing page. Also, once you sign up and become part of it, that's when you can get access to the Facebook group. So I encourage you to join us in this community. Please like and share this video, like and share our events so that we can get more people aware of what's happening in nursing. I'm excited about this challenge, and so you'll see more and more as we're getting to do things out in the community. We're doing more for our nurses and really advocating for nurses, and so that's what we choose to do. I'm a nurse, love nurses. In fact, plan to be buried in my nursing uniform. That's how much I love nursing. Maybe that's going overboard for some of you, but that was always been my dream. Full whites, nursing cap, which I have, and my Red Cross pin. That's always been my plan. But I'm going to say this. Have a good evening. Enjoy. Look forward to seeing you next week, starting our challenge, which will be immediately after our Facebook Live on Wednesday. We start the challenge. So now's the time to get into that challenge. So go over to our Nurse Shark Academy page. You can find the new group over there for the challenge, for the Nurses Get Mad Challenge. Go over there today. Thanks for having us. Have a great evening. See you next week.